Allie became part of our family in 2009 when we started foster to adopt her. She had just had her first transplant, heart transplant. She was just a little over 2. On February 28th,
2014.
she went for an annual heart biopsy cath, which had been excellent for 5 years. We had no major issues whatsoever. She had coronary artery disease, severe coronary artery disease, which had developed in under 10 months. So everybody was floored, and there was nothing that they could do except another heart transplant.
Allie was transferred to us as an infant after having had a congenital heart repair as a small infant that was successful. However, her heart muscle was so severely damaged that it couldn't function well enough without a transplant.
Dr. Addonizio is a fantastic colleague and pediatric cardiologist who was involved in the world's first successful pediatric heart transplantation on a 4-year-old child. She started the pediatric heart transplant program here at Columbia University and been the mother of pediatric heart transplantation in the country and the world. In her way, she is one of the biggest heart donors because she puts her heart into every one of the patients that she cares for.
Oh, you like hearts?
Dr. Addonizio is just about the kindest person I think I've ever met. She treats you like a person. Allie has some crazy questions for her sometimes, and most of the time they have nothing to do with medicine. And she's more than willing to talk about everything that Allie wants to talk about.
She doesn't try to sugarcoat it. She tells you like it is, and you appreciate that because, you know, as parents, you gotta know.
The days waiting for a heart transplant, you're very, very anxious because you don't know. It could literally be any second.
Barbie didn't come home at all.
One time.
One time to pack a bag. She was there for 4 months straight, sleeping in the same bed with that child.
She really wasn't allowed to leave the floor very often. Arts and crafts, a lot of iPad, a lot of time with her brothers when they would, come, which was quite often to play. If they were there, she was thrilled to pieces. When she found out she wasn't going to be able to be at her dance recital, that was heart-wrenching to Allie. She got to do her own little dance recital. It was beautiful. She got to wear her costume. We set up a little stage in the playroom. We sold tickets, had refreshments.
The whole staff at Columbia Pediatric Hospital, they're just amazing people. They really go out of their way to make you feel comfortable.
Allie totally gravitated to Takuma because of their twin hair. We even took pictures of Takuma wearing Allie's hair bows. Very cute.
We have some kids that come in and then a week later they have a heart. We have some kids that come in and it takes almost a year. DNA and blood typing and all that everything has to match for it to work. With Allie, it was pretty rough because the nature of what she was dealing with. She had her up and down days like anybody else, but she was really good about it. I think she understood that this was a serious matter.
The best part about the day that it did happen, we were all there. My son was there. Our grandparents were there. It was like surreal. Everybody was there.
And then told Allie, but reality is frightening. So her first was fear, and then she was crying. And I was like, Al, but you know what that means? I said, we're gonna get to go home. And when she realized the light at the end of the very long tunnel, it was all good from there. It went amazingly well. She was home under 3 weeks. She's back to school, no restrictions at all. She takes gym at school, she goes to dance.
Really in no time, she was back at it. Feeling great and able to, get involved and join in the fun.
Allie, I love you. I'm glad you're doing well. And it really couldn't happen to a better person.
What I'd like to tell you is I'm very proud of you, and keep doing what you're supposed to be doing, taking your medicines, pay attention to your mom and dad, and keep having fun.
Dr. Addonizio, without you, Allie would not have received her first heart or her second heart, and we would not have been able to adopt Allie, and we would never have even known who Allie was. So on many levels, medically, personally, without you, we wouldn't have our daughter. So we would very much, as a family, like to thank you.